Okay. Can I get a thumbs up? Can everyone see my screen? Great. Awesome. Thank you. Well, thanks for coming, everyone. We're really pleased to see so many new faces and familiar faces on the call. My name's Carol Lavoie-Schuster, and I'm the Vice President for Grants, Nonprofit, and Donor Services here at ECCF, Essex County Community Foundation. Today's session is an information webinar. If folks could remember to put yourselves on mute, I would greatly appreciate that because there's some feedback. Today is an info webinar on the Food Security Grant Program, which is a CARES Act Community Development Block Grant. And for the agenda, I'm going to review an overview of the fund and the new grant program. We will go into the grant guidelines, requirements, reporting, and timelines. And that'll take probably maybe 10 to 12 minutes, 15 at the most. And then we will have some time for Q&A and dialogue. How does that sound? Great. All right. So ECCF, for this grant program, Patty, I'm going to ask you to remind folks to mute themselves or go ahead and mute folks when they enter the call. That'd be great. ECCF has partnered with the Massachusetts Department of Housing and Community Development, DHCD, to administer $3.1 million of CARES Act unmute myself, also known as CDBG Food Security Program. Now, our work is obviously focused in the 34 cities and towns here in Essex County, but it is a Commonwealth-wide Massachusetts program. And there are 13 other community foundations / community organizations that are also part of this, many of whom are our sister community foundations that we partner with on a lot of other work. The goal of the work is to significantly impact vulnerable and underserved populations across Essex County who are living below 80% AMI and households with no or very limited access to sources of economic relief. The way that we're going to do this work is naturally by partnering with you all. You all are the partners on the ground and the 501c3 organizations who are working with clients in the community who meet the criteria above to get the vital resources to them. It's a 12-month program. The application, as you know, opens later this week. The deadline is in the end of February, mid to end of February, and decisions will be announced on Friday, the 25th of February, and the cycles begin early this March. Now, who can apply? Qualified 501c3 organizations who are focused on food security. Organizations, you must demonstrate that your work is committed and based here in Essex County, and priority would be given to organizations based in Essex County. Now, I know that there's a lot of great food organizations who may have their headquarters outside of Essex County, but focus here in the county, and that is permissible to apply. However, we're going to be focused or placing a priority on organizations based here in the county. The qualified uses for funding include 3 categories: food, labor, supplies, materials, and other costs that are required that you need to run your food provision program, such as rent, utilities, salaries, and administrative costs. And then lastly, this category is what I call the small capital expenses. So these are things that you need to deliver your food security program. So it could be a small truck, freezer, other items that sort of fit into that small capital service. Applicants can apply for grants between $25,000 to $100,000. And as I mentioned before, the grants need to be administered over a 12-month period. Now, if you are awarded a grant, your grant, up to 10% of each grant, can be used for administrative expenses associated with the provision of the service in this specific grant. As a reminder, this is not an ECCF discretionary fund. We are adhering and are stewards of the CDBG initiative. And so we have to adhere to numerous other requirements as part of this grant. Those of you who are familiar with CDBG grants, none of this will be a surprise to you. However, some of the things that we have to adhere to as part of the application process include confirmation that you'll be able to complete a monthly data set. And I will show you the sample of what we'll be tracking every month. The ability to demonstrate that at least 51% of the persons that you are working to serve through this program or this application are low and moderate income. So again, that up to 80% AMI. You have to demonstrate, and we would work with you on your ability to keep track of each recipient through self-attestation forms. And depending on the type of grant that you're applying for, the CDBG and DHCD are allowing us to qualify regions of delivery in the instance of a truck by capturing or qualifying rather other areas like low and moderate income areas, particular populations such as public housing residents, or those that are categorically eligible. And then the last two requirements is applicants must demonstrate that you have seen a quantifiable increase in your services due to COVID, which I'm certain is no problem for everyone on this call. And then lastly, that the funds aren't being duplicated to recipients. The required forms and reporting that I just mentioned a number of these, but there are actual specific forms that as part of these contracts will be required, include a professional services contract, the duplication of benefits certification, that monthly report I talked about, which I'll show you in a moment. And then the monthly allocation submission will be a somewhat of an invoicing process that is a requirement of CDBG that we will be working with all recipients on. So it'll be a way to submit expenses associated with the breakdown of this grant. And then the last thing is this self-attestation form, which is a record for each recipient of rewards, the actual client on the ground that is receiving the resources. We're required to have a record of each of those. Now, ECCF, we certainly understand that there are unique needs with different types of clients. And so those of you who are used to CDBG grants are accustomed to this. Those of you that might be newer, we will work with you if you are awarded a grant to design something that is efficient and can work within your program's capacity. Here is the dashboard of what will be required to capture every month. We're designing a streamlined system for you to plug in this information and work with our team. And then we will be collecting it monthly and plugging it into the CDBG IntelliGrants program. And then lastly, just some important dates and deadlines. There's the 2 webinars, which you're obviously on one now for the session for the upcoming grant program. These are recorded and the information will be shared on the website for you to review later. February 18th is the deadline to submit applications. On Friday, February 25th, we will be making the award and denial notifications. March 11th is if you are a grant recipient, when you'll be asked to submit your first allocation as part of that grant process. And then we will establish that monthly reporting schedule with each grantee. Ideally, it'll be the same for all recipients. And as I mentioned before, this is a 1-year grant program. I hope you've all been able to read the guidelines. Here is the link again. This will all be published right on our website on this deck. And then lastly, if you have any questions, I am extremely accessible. My contact, my colleague, my new wonderful colleague, Patty McCullough, and I will be working in tandem to ask any questions. and all of our contact information is here. I do just ask that if you want to use my cell phone just during business hours, please, and the preference is to try to book an appointment. And that you put in the subject line this header here so that we can make sure that we're attending to these in a really rapid fashion. So now I'm going to go ahead and stop sharing so I can see the screen. And answer any questions. Thanks, Scott, for that notification. We'll make sure that we update the information. It looks like there's a discrepancy on some of the dates on the deadline. So I'll take a look at that today. Okay, I have someone raising their hand. Julie LaFontaine.
Hi, everyone. First of all, thank you for taking this on. This is not for the faint of heart, so we really appreciate Essex County Community Foundation stepping up to take on the administration of this program to really help our agencies. I had a couple of questions. I don't know how, if you prefer me to do them one at a time or ask one and then let someone else ask questions. But I think my first question is, we submit a proposal, and who is reviewing our proposals?
Our grants team, our grants review committee is reviewing the proposals.
And are those volunteers from the community or just the team members from ECCF?
Yes, it's community members as well as staff. Excellent.
Can the attestation form be electronic?
Yes.
Okay.
Although, let me pause there. There does need to be a record. Each recipient, the grantees, need to have the full records available should there be a review, which I think that Julie, you'd probably be accustomed to.
Great. And has there been given any thought to the duplication of benefits? We know that being in the food pantry business, especially, people are going to more than one food pantry to get what they need, and just wondered if there'd been any thought about that.
That's a good question.
Yeah, the duplication of benefits is it's a really good question. So we're working with CDBG to figure out how to do that tracking based on their recommendations. So we're trying to kind of work through that based on how you are tracking your recipients across the numerous food banks. So we'll be working with each of the grantees on that.
Okay. And then my last question is, how are we laying a baseline for increased service over pre-pandemic?
Right. So they've asked us to capture the record the month prior to the beginning of the pandemic, so February of 2020.
Okay. Thank you.
Yeah. Okay.
Thank you. That's it.
All right. Thanks, Julie. Newland Coalition. Is that Jonathan?
Hi, yes, this is Jonathan. Sorry to keep my camera off. I'm using my phone today. Nice to see you, Carol. Thank you for sharing all this information. Please ignore my email about not being able to get in. I had a couple of questions for you. The first was actually coming off of that last one. Our program started during the pandemic. Would growth just be demonstrated with 0 recipients for February? Okay.
Yes. Very good question.
And then our list changes over time with each new wave. We get a new wave of positive COVID patients who we deliver to for a short period of time. And we also work with a number of undocumented individuals who are really reasonably concerned about their identities being shared. So I'm just wondering if you could speak a little bit to that, to those two issues with the reporting requirements.
Sure. So for the reporting requirements, they have shared that the identification of the individuals can be kept with you to ensure safety and anonymity. And Jonathan, just like the other program that we work together on, which those of you that are on the call may not know about, but we work with another initiative with DHCD, which is designed to get resources to those that can't get access to resources through state or federal for varying levels of status. We've kept the individual names of the recipients at the organization who has the primary relationship. What we need is just the confirmation that you have that information and that you have each record. Does that make sense? So it's very similar to how we've done it with DHCD, where we never saw the names of people, but you had confirmation that you had the identification, the confirmation, and the name of each of those people. They've confirmed that that is a qualified way to do it.
And just so I'm clear, that also means that DHCD won't be looking at these barring an audit sometime in the next 7 years.
When they have said that they would look at further review, they have not confirmed exactly what that means. What they have said, though, is that they don't need to see an individual name. So it is a good question for me to clarify with them. Just as we did in the other programs, Jonathan, we understand like the sensitivity. I think what they need to see is the signature if they ever do audit.
Okay, well, I can follow up with you
Yeah.
off to figure some of this stuff out for us. Thank you.
Yeah, absolutely. All right. We have Lisa.
I just have just a quick question as a follow-up to the duplication of services. And assuming that we would only be worrying about duplication of services within this funding pool, or do those of us who are administering other CARES funds need to be worried about also matching up with our other service records for, especially for food insecurity?
Right. Are you saying, will you need to be concerned about matching up? Yes.
Yeah.
Yes.
We will? Okay.
Yeah.
Thank you.
Yeah. And that's something that we, as the administrators of this, are trying to work through a process of how to clearly delineate and match those pieces of information up. Okay, Casey. Casey, you had a question?
Thank you, Carol. Yeah, this is helpful. Could you, two questions. One, I can't access the application portal. I don't know if other folks have seen it yet. Maybe
It's not live yet.
Oh, okay. I thought you said it was before. The other is, can you provide a little bit more guidance on what counts as small capital projects? Because yeah, I saw it said trucks on there, so that feels relatively big, but
Yeah. Yeah, I think anything smaller than a truck would qualify. So freezers and trucks are the two examples that they have given. Anything that is related to the delivery of services that is required for you to be able to meet this increased need. So it could be storage, again, freezer, truck, those types of capital expenses. It cannot be used for retrofitting a facility or building out new space, which would constitute as large capital. But one of the benefits that we saw to this was that you can utilize it for staffing and rent, which was a big differentiator versus just being able to use it for food. Okay. I'm sorry, I don't have a name. I haven't, Egan, if you could. And then I have Corey. Jackson after that.
It's Irene Egan. Hello.
Oh, thank you, Irene.
Just wondered, do you know what the AMI is for the area? For Essex County?
I wouldn't, well, it's different based on the community you're in, Irene. I'm not sure the community that you're in.
Okay.
Yeah.
Um,
So that would be up to you to tell us
I
the
see.
community that you're serving,
Correct.
to be able to demonstrate that the people that you hope to support are within that threshold of under 80% AMI.
Thank you.
Okay. Corey,
Hey, how you doing? It's good to see
good.
you.
How are you?
Good. I have a question about timeline. So, like probably many of us here, we received CARES Act money a while back and have probably long since expended that money. Will this just be from the grant approval forward in terms of spending, or can it be applied backwards a little bit?
Forward.
Okay.
Yes. Good question. Thank you. Curtis, I see you raising your hand. Thank you.
How you doing? Welcome.
Good.
Thank you for doing this. I had a question that's a little bit out of the realm of the usual discussion. There's 24 Afghan refugees that are living in the church where we have our program among friends. And I don't know, I mean, they have no income, so, or how do we, I mean, could we help them out with food provisions?
Yes. Yeah.
So
And
they
we can talk after this on how
Okay,
to
that's fine.
work that. Yeah.
The second question was in the qualifiers, public housing, when you're talking about all the qualifiers in terms of income, monthly reporting, capacity, and so forth. So if someone was, obviously homeless, or we weren't sure where they lived, can we hand them a form that you can provide us? Or is that, that they could fill out and sign in terms of what they may or may not?
We could look at what you may already have in place, Curtis, as I'm not sure how you're doing your food delivery program, but we could connect and look at what you have in place and then look at how to support you in designing something that would meet the CDBG
Right.
requirements.
The food delivery program goes to individual housings, public housing, as you know, work, so with money. And then
Yes. So we do have a template sample from them for the self-attestation form, which we will be sharing on the website, and that could be used as a template.
All right, thank you.
Okay, I think it was Liz and then Velma.
Hi, thanks. Two questions, one about tracking and one about applying in partnerships. Curious, it seems very direct if the funding is going to food, tracking the demographics around the households that are receiving. But if we are applying for a capital purchase that might be supporting our work that serves a variety of different households and across demographics, just curious the logistics of how that works. This is our first time with the block grant, so sorry if that's an ignorant question.
No, not at all. In fact, that's been a question that we have raised as well to DHCD and CDBG, because this is the first time they're allowing those types of expenses. And so we will be working with grantees to, do one of two things. Each recipient they've told us, need that self-attestation form. So we will need to kind of co-design a way, if the instance is a truck, that if you're going to a housing complex, that we can then streamline a system that could get a record of a signature of each of those people. So for a few of these capital expenses, or a freezer, for example, we are going to need to sort of co-design that tracking to understand the unique needs of your organization.
And are the attestations like one per household, or are you looking for individuals even within households?
Individuals.
Oh, wow. Okay. That's helpful. Thank you.
Mhm.
And then just wanted to ask about, a lot of us here do work in partnership and might consider applying sort of together, but it seems like with duplication of benefits, this is a better fit for individual organizations to apply just as a solo entity.
That's correct.
Okay, thanks.
Yeah. Okay. Vilma.
How you doing? Nice to see
Hi.
you.
Nice to see you.
So this is CDBG funds tend to be federal funds, and I know that Pearlie Curtis spoke a little bit about it, but he referenced income. But someone with who is undocumented receiving federal funds, is that doable with this grant?
Yes.
Just wanted to clarify.
Yeah. Thank you. Okay, Julie.
I just had a clarification question. I wanted to make sure that I heard what you said to Liz correctly. I am unaware of each individual in the household having to sign an attestation form. But I thought I just heard you say that they would have to. Can you speak a little more about that?
That is how the information has been shared with us from THCD and CDBG, that on an individual level, it would need to be recorded.
Okay, and not just the person coming from the household.
If
Pick
the
up
person,
food.
yes, that is the person that would need to complete the, sorry, there is a distinction there. The person
Okay,
that
so
is
not each person in
receiving,
the household. Yeah.
correct, yes.
Okay.
The person that is receiving the food, the product, the food, would need to complete the self-attestation form.
And
Thank
that,
you for
that
the-
remains
thank you for the
consistent. Yes,
clarification.
thank you.
Yes. Yeah. And sorry, apologies, Liz. I thought that that's what you meant, each person receiving food. But there is a distinction because in the example you're giving, someone could receive the food and then obviously bring it home to their family. So it's the person who is actually in receipt of the food that completes the self-attestation form. Vilma, did you have another question? No.
I forgot to put my hand down.
Okay. I'm sorry, I can't remember your first name. Is it Irene? Mhm.
I'm with the Merrimack Valley Food Bank. We don't serve people directly. We, supply to food pantries. Would we be eligible for this grant?
Yes.
And if so, would we need that information from the agencies that we are supplying?
Yes.
Thank you.
Mhm. Lisa.
Carol, I have not, I apologize, been able to really drill deeply into this. Are food expenses required in this grant? Or could we look to this grant to cover the operational end of food that we're buying with other funds? For lack of a better word. So
Yes,
often we have money that allows us to buy the food, but as you pointed out, doesn't cover necessarily the staffing piece of it.
You could put in for all staffing or capital or all three categories, which I think is one of the unique aspects of this. But it is not required to purchase food. Are there other questions? I'm not seeing anything in the chat box. We will look at those corrections. I understand some of the dates, the timeline dates are off, so we'll make sure we correct those and send out an updated sheet of information. Oh, Scott, you have a question?
Thanks, Carol. I know you said this a little bit earlier, but would you share a little bit more about the definition of a new service or quantifiable increase, and just in terms of like what time frame we should be considering this?
Sure. So they've asked us if you could quantifiably, start with February of 2020, and then based on the next month or when you have seen an increase in your services, record the difference, that increase. Whether it was immediate in some instances or a slightly slower roll if some organizations didn't see that spike in services in the summer, we would expect to see when you saw the increase in services, which I think everyone on this call has seen, and then consistently it has grown. So they just want to see what it was pre-pandemic to the first spike and then now. So what those rates of increase have been.
Okay, thank you.
Okay. Are there other questions? Okay, great. Well, we will be posting the recording. If you have other questions or want to meet one-on-one with us, please send an email to set up a time for us to talk through. And let us know if you have any other questions.
Thank you.
Thank you, everyone, for coming.
Thanks so
Thank you,
much.
Carol.
Thank you very much.
Thank you.
Bye-bye.
Bye-bye.